Shadowing, walking the walk, an in-depth look at how to shadow. Shadowing can be defined as direct, real-time observation of patients and families as they move through each step of a care experience. Shadowing includes the development of a care experience flow map. Together, these provide a deep understanding of actual care experiences, leading caregivers to feel an urgency to drive change and to perfect the care experience. It is an easy and inexpensive method of viewing all care experiences through the eyes of patients and families, and provides a mechanism by which patients and families and caregivers participate in co-design of healthcare delivery, serving as real-time patient and family advisory councils. When contacting the patient and family, you want to be sure to explain your role as shadower. Your role is to observe, record, and evaluate their care experience so you can improve the delivery of care for all patients and families now and in the future. This will be a primary means of engaging patients and families in co-designing exceptional healthcare experiences. You are not there to serve as a secret shopper. In most cases, patients are willing to be shadowed, especially when they are told that their participation will help others.
Hello, could I please speak with Mr. Jackson? Thank you. Hey, Mr. Jackson, my name is Andrew. I work with your orthopedic surgeon. Yes. I understand that you have an appointment with him tomorrow, and it's at 10 o'clock. Well, I was just calling to ask you if you would mind if I shadowed you through your appointment tomorrow. I can meet you at the first floor parking garage outside the elevator, and I will simply take observations and experience everything that you experience. The purpose of shadowing is to view all care experiences through the eyes of the patients and families. By following you through your care experience, by making observations, and by getting a first-hand look at your perspective, we are able to utilize your input and experiences to co-design quality and process improvements throughout all aspects of healthcare. Yes, is that okay with you? Alright then, I'll meet you at the entrance at the first floor outside the elevators, and then we can walk to the orthopedic office. Yes, I'll see you at 10 a.m.? Great, thank you so much. Yes, everything's anonymous. Yes. Alright, Mr. Jackson, thank you so much. See you then. Bye.
When shadowing, you want to be sure to take thorough notes. Your notes will be your primary resource for providing feedback. Things that you want to look for include who the caregivers are. A caregiver is anyone who contributes directly or indirectly to a patient or family's care experience. Pay attention to the touch points along the way. A touch point is the point at which any caregiver touches the care experience of any patient or family member, including parking garage, lobby, registration, exam room, etc. How long does each process take? What are the first-hand comments, questions, and concerns raised by patients and families? And finally, what are your impressions, observations, and ideas for improvement? This is an example of a care experience flow map. Use this throughout the video to capture the touch points, caregivers, and interactions that occur throughout the care experience. We will review this at the end. We will now begin with our shadowing experience. Be sure to take careful notes and pay attention to all the different areas and touch points that the patient encounters.
Hello, are you Mr. Jackson?
Yeah, hey, nice to meet you.
How you doing? I'm Andrew. I spoke to you yesterday.
Alright, cool. And this is my mom, this is the guy I was telling you about.
Hi, Andrew.
Nice to meet you too. How you doing?
Good.
So I'm going to be shadowing you today, and just as we discussed yesterday, I'm going to follow you around through your care experience and make observations and just try to experience what you experience and see it through your eyes. Do you have any questions before we start?
No, that sounds good.
All right.
Hi, can I help you?
Yeah, I'm here to, actually I'm here for my appointment.
Okay, and your last name?
Sure. It's Jackson.
Okay, and first name?
Steve.
Okay, Steve, what's your date of birth?
12/25/86.
Alrighty, and since your last visit here in May, have you had any updates in insurance?
Not that I believe so.
Okay. Got you checked in here, and we'll be with you in a few minutes.
Alright, thank you.
Thank you.
Steve, come on back.
Good, how are you?
Good. My name's Dana. Welcome to the park. Take you back and ask you some questions.
Okay.
And we'll get some x-rays, okay?
All right.
Right here. Have a seat. So, Steve, so what are you here to see the doctor for today?
It's my hip.
Okay. You're here for your left hip?
Yeah, it's my left hip.
Okay. How long's it been bothering you?
A few weeks now.
Okay. Where's most of your pain?
Just right on the ball of the joint.
Okay. And do you have pain when you're sitting, standing?
All the time.
All the time, okay. Any surgery on your hip at all?
No, not yet.
Okay. Have any back problems or back surgeries, anything like that?
No, nothing like that at all.
Okay. Have you ever had an x-ray or an MRI or anything?
Yes, I have.
Okay. Do you know what that showed?
Just some swelling, really.
Okay.
But that was a while ago, so.
All right. And do you think you might be considering surgery on this, or you just want us to take a look at it today?
Well, I'd like for it to be better. So.
Okay. All right. Well, what we're going to do is we're going to get some x-rays today, so we'll get you back and do that next, okay?
All right.
She seemed to be really nice, Steve.
Yeah, she was nice.
Yeah, I just wish that there was some reading material in here while we wait.
Hello, Steve.
Hi.
My name's
Yeah.
Natalie. I'm going to take you for a few x-rays with the doctor. You can stay here and back in a few minutes, okay?
Alrighty.
We're going to go head out the door to the left.
There will be times when you will be unable to shadow the patient. It is at this point when you shadow the family. Their experience is just as important as the patient's, and the family can usually provide valuable information about the process and their experiences.
All right, we're back. Go ahead and have a seat on the table. I'm going to pull up the x-rays. Okay.
Thank you.
We'll see you. You're welcome. Thank you.
Hi Steve, how are you today?
I'm good, how are you?
I'm doing good. I'm Mike, I'm one of the physicians here. Nice to meet you.
Nice to meet you.
So we got some x-rays today. I understand you're having some problems with your knees, you're having some pain.
That's my left hip, actually.
I'm sorry, yeah, it's your hip. You're having some difficulty with your left hip. So we got some x-rays. The x-rays do show that you have some pretty significant arthritis. And essentially what you can see in the x-rays is your bone on bone right here in this left hip, with this being your left hip, this your right. And essentially when it becomes bone on bone like this, you have the option for surgical correction. But what we can do is we can actually do what's called a total hip replacement, where we replace that hip, put in a prosthesis, and it's an extensive rehab process, but most patients feel significantly better afterwards, and they feel that their pain is largely gone.
Okay.
Do you have questions about that?
Yeah, how long is the rehabilitation process? You know, I have a life.
From start to finish, it can take up to a year, but generally you're in the hospital for about 2.5 days is the average, and from there we discharge you to home. Once you're at home, you have an in-home therapist work for you for about a week. They come to your house and work on general physical therapy. After that, you'll start outpatient therapy. Most patients, I would say, on average, do about 6 weeks of outpatient therapy, and then they can work on home after that.
Okay.
Okay.
All right, well, when can we get this process started?
Well, the lead time for surgery, I would say, is about 2 to 3 months, and during that time what we do is we do a lot of preoperative testing. We make sure if you need any clearances from your other physicians that we can get working on those. And then what we do is we have you come in before surgery, about a month beforehand, and we get some chest x-rays done, an EKG, some blood work, and we have you see me on that day as well.
Okay.
Okay. And what I can do is we can schedule that appointment. I'll have Tisha, one of our surgical schedulers, give you a call to set up the actual surgery date, and she'll also get you started with the preoperative work that you need to get started on.
Okay.
Okay?
All right, well, that sounds good.
Okay.
Hi, I need to schedule my follow-up appointment.
Okay, what's your last name?
Jackson?
Okay. We need to see you back in, what, 2 to 3 months?
Yeah, that's what he said.
How does Wednesday, April 20th sound?
Good.
Okay.
Yeah.
1 o'clock?
Sure.
Okay. Okay. Here's your appointment card.
Okay, great.
Thank you.
Before you leave, we do have a co-payment. Looks like it's $20. Do you want to take care of that before you leave?
Sure.
Okay.
There you go.
Thank you. Would you like a receipt?
Yeah, thank you.
Okay. Alrighty, you're good to go. We'll see you in April.
All right, thanks. See you
You're
then.
What did you observe through the shadowing? Were you able to capture patient comments and reactions? Were you able to observe bottlenecks? And were you able to identify all of the touch points throughout the care experience? Here is what the completed care experience flow map should look like. As you can see, along the left side are all the identified touch points experienced by the patient and family. They are parking, sign-in, waiting room, patient room, x-ray, and checkout. Along the right side are the activities and caregivers the patient and family encounter at the various touch points. Even if you didn't observe all of these firsthand, you can gather this information by speaking with the patient and family. In addition to a care flow map, you also want to provide an observational report. This report highlights the reasons for the shadowing request, when and where the shadowing took place, the order of events, comments made by patients and family, comments and suggestions made by caregivers, and observations and recommendations for improvement. Through patient and family shadowing, you will be able to change the way patients and families experience their care, transform the way you experience your role as a caregiver, break down the silos that stand in the way of satisfaction for all involved, and change the culture of your organization. Shadowing is real-time patient and family advisory counsel, and the first step to co-designing care with patients, families, and caregivers. Because patient and family shadowing is simple and effective, you can use it over and over again to continue to seek the ideal state. Evaluate the current state and measure outcomes so you will always be working toward achieving a higher standard of the ideal patient and family care experience.